Hello, I'm going to talk to you today about male infertility. Traditionally, infertility is looked at as a woman's problem. However, in 20% of infertile couples, you can trace the problem entirely to the man. And furthermore, in about 30% of infertile couples, the problem can be related to both the man and the woman. So in a significant number of infertile couples, the problem is related to the man, and attention to male infertility factor becomes very important. Infertility itself can be very emotionally difficult for the couple, and it can be very frustrating, and there are pressures from everywhere. And some people will accept that that's what their destiny is, but others will want some treatment. And we are lucky these days that there are many types of treatments, and there are lots of advances in technology and surgical treatment that we can help many infertile men. So let's look at the reasons why a man becomes infertile. I mean, if you think about it, you will need to have a healthy testes to produce the sperms. You will need to have a healthy tubes and pipes so you can take the sperms to the outside. At the same time, you need to have healthy hormones to help with the production of sperms and the maintenance and the maturation of sperms. And then the genes or the background genetics of that person need to be normal. Okay, so you can have problem with the testes itself. The size of the testes can be small, it can be just didn't grow into the right size, or it could be injured by trauma. It could well be affected by infection, inflammation. Generally, sexually transmitted infections like chlamydia can lead to all sorts of problems with the production and with the blockages. Childhood infections that can happen like mumps. When it affects the testes, it can affect the production of the sperms. There's a condition called varicocele, which is very common. That's distension of veins around the testes. This itself can cause changes in how the sperms mature. It can affect the sperm's ability to move and motility, and that itself can lead to a problem with conception. Also, it's important to have the right hormones for the sperms to mature, and in certain individuals with certain problems with hormone production, they can have difficulty in conception. And also what's important, genetics. We know certain genetic conditions that can affect fertility and the production of sperms, and obviously in that case specific genetic counseling and testing may be required. All these conditions can lead to problems with the sperms, the quality of sperms and the quantity of sperms. Specifically so, if you have no sperms coming to the outside, that condition called Azoospermia, which itself a very important condition that we can talk about it some other time.